Typically, a Wegovy course starts with a weekly dose of 0.25 milligrams. This will then be increased to 0.5 milligrams after 4 weeks if it's well tolerated. Then 1 milligram, 1.7 milligrams, and 2.4 milligrams in 4-week intervals. A full dose of Wegovy is 2.4 milligrams, and once you've reached this dose, you will normally stay on it for the duration of your treatment. Wegovy comes in a 4-dose pen. This means approximately every 4 weeks of using Wegovy, you'll need to use a new pen. There are 5 different doses available and they come in different coloured pens. You'll typically start at the lowest dose and gradually increase over time. It's recommended that Wegovy pens are stored in the fridge. However, once they're in use, you can store them at room temperature for up to 6 weeks as long as the pen cap is on. You can choose to inject Wegovy into your upper arm, your upper leg, or in your stomach. If you choose to inject into your stomach, we advise that you leave 5 centimeters between the site and your belly button. You can inject into the same area each week, but make sure it's not the exact spot as last time. You can take Wegovy at any time of day, with or without food. If you experience side effects from the treatment, this might dictate when you decide to take it, but it won't affect everybody. Wegovy is injected once a week on the same day each week. You can change the day and the timing of your dose as long as there is 72 hours or 3 days between your injections. If you miss a dose of Wegovy, you should take it as soon as possible and within 5 days of your missed dose. If more than 5 days have passed, you should skip that dose and take the injection on the usual scheduled day. If multiple doses are missed, then I would advise informing your doctor as you might need to lower your dose. If you stop taking Wegovy, it will typically take up to 7 weeks for the medication to fully leave your body. At this point, you'll no longer experience the effects of the treatment. As with any injectable medication, Wegovy pens can cause reactions at the injection site. This can include bruising, but it can also include swelling. It can cause redness, itching, or soreness. But these effects tend to generally improve over time as your body gets used to the treatment. Diet is an important component of safe and effective weight loss. You should try and maintain a healthy, balanced diet whilst taking Wegovy. This means avoiding foods or cutting down those foods that are high in sugar, salt, or saturated fats. This might include fried foods or processed foods as well. It's safe to drink alcohol while taking Wegovy, and your diet plan might allow for this. It's important to avoid high-calorie, sugary drinks of any description while taking Wegovy, and for some people it might affect their alcohol consumption. Exercise is also important for weight management. It's important to make gradual changes to your activity levels and not be over-ambitious straight away. If you've not exercised regularly before, you could start by doing something active once a week. You could then gradually increase the amount of time you spend exercising and the amount of days that you exercise on as you start to feel more comfortable doing so. No, Wegovy should not be taken alongside any other medication that's intended for weight loss. 1 in 10 people using Wegovy can expect to experience some side effects. These can include headaches, nausea, vomiting, changes in bowel habits, and it can cause some tummy pains as well. You might also feel weak or tired, but these will typically go away over time. For a full list of the side effects, you can check the patient information leaflet, and if you're concerned about any of the side effects that you're experiencing, please discuss these with a doctor. It's very uncommon for patients taking Wegovy to experience hair loss, but it has been reported in some rare cases. If you're planning pregnancy, it's recommended to stop your Wegovy treatment at least 2 months before a planned pregnancy. Wegovy won't stop you from getting pregnant. However, if you find out that you are pregnant, please stop and inform your doctor. Weight loss and use of semaglutide during pregnancy is not